what about a fourth dose? Do we need a fourth dose? People have heard about Omicron, and now they've started hearing about the subvariants of Omicron. BA1 was the first kind of what we called Omicron, which took over in December. But then we had a second wave with what's called BA2, which is a subvariant of Omicron that's about 30% more transmissible. And now people are hearing about BA 2.1, 2.1, which is what's taking over in the US. And then there's BA 3 and 4 and 5 in South Africa. And so there's a lot of subvariants. And basically, we're climbing a ladder of contagiousness. It's getting more and more contagious. And this is where it becomes important to start thinking about fourth doses, because we're seeing a lot of burden of disease. We're seeing a lot of people get infected with increasingly transmissible variants. Rule of thumb is that it's a law of diminishing returns. Each shot you get is less important than the prior. So really important to get your primary series with 2 shots. We talked about the importance of a booster, particularly with Omicron. Less important than the second shot, but that third shot is really important. But now the fourth shot becomes even less important because you have such good protection from that primary series plus booster. The reality is that your protection after a third shot, just like we talked about after a second shot, does start to wane, and your protection against mild infection does wane quite quickly, several months after that third shot. But importantly, your protection against severe disease is sustained. And so for that reason, it really is, because the benefit is small, and there is a small benefit even for severe disease, it's most important to think about fourth doses in people who have a high risk to begin with. And that is a relatively smaller portion of the population than what we recommended third doses for, which is basically everyone over 12, and soon to be basically everyone. So for fourth doses, the idea is what the NACI has said is, look, anybody who's over 80 and people who live in a congregate setting with a long-term care home, people who are in a high-risk environment. Certain provinces have used a little bit of a lower cutoff based on some data that suggests some benefit. And so in Ontario, that cutoff is over 60. Bottom line is, if you meet the criteria, if you're over 60, go out and get your fourth dose. But if you don't meet those criteria, don't fret, because your protection from 3 doses, particularly against severe disease, and that's what we care most about, remains very good.